Attention. This is an important message about Medicare.
Hi, I'm Congressman Mark Pocan.
Hi, I'm Congresswoman Jan Schakowsky.
I am Congressman Ro Khanna.
And I'm here to talk to you about Medicare Advantage.
About Medicare Advantage.
About Medicare Advantage.
Yep, that's me. You're probably wondering how I ended up in this situation.
We want to make sure America's seniors know that private, for-profit insurance, also known as Medicare Advantage, is not Medicare.
And that's why we've just introduced the Save Medicare Act.
Private health insurance companies get seniors to sign up for private plans rather than Medicare by calling themselves Medicare Advantage.
But Medicare Advantage is neither Medicare nor an Advantage.
These plans seem cheaper or seem to offer additional benefits, but in the long run, they often don't cover the more expensive care that many retirees need.
So we want to stop private plans from calling themselves Medicare
and protect actual Medicare.
Making sure seniors' care is covered for the rest of their lives by a program with the power of real Medicare.
So don't be fooled by the commercial gimmicks.
And don't call 1-800-anything.
Get the program you've paid for and earned. Remember, only Medicare is Medicare.
Only Medicare is Medicare.
Only Medicare is Medicare.
This is Michelle Swenson, producer of Truth Seekers Health Justice podcast. Today we look at the Save Medicare Act, a bill whose goal is to preserve and differentiate the publicly financed traditional Medicare model from privatized for-profit Medicare Advantage plans. 3 Congress members, Representatives Mark Pocan, Ro Khanna, and Jan Schakowsky, reintroduced the Save Medicare Act on February 1st, 2023. Said Representative Khanna, "It's time to call out Medicare Advantage for what it is, private insurance that profits by denying coverage and deceptive advertising used to trick seniors into enrolling. Medicare Advantage has been part of a long-time scam to undermine and privatize traditional Medicare, as related in the recent Truth Seekers Health Justice podcast titled Medicare Disadvantage Fraud, Milking the Medicare Trust Fund. Many cable news watchers are inundated with commercials promoting private Medicare Advantage health coverage plans during open health coverage enrollment periods. As former insurance CEO and whistleblower Wendell Potter observes,
it's important to note that it is neither Medicare nor is it an advantage. It is, I think, will be recognized in years to come as probably the biggest heist, the biggest fraud, the biggest transfer of wealth from taxpayers, middle income, low income Americans, from them to corporate executives and shareholders. It is a plan that has been around for about 20 years, born during the George W. Bush administration when Republicans controlled Congress and they were determined to start privatizing the Medicare program. It is a private program. It is operated by private insurance companies. Most of them are for-profit.
Medicare Advantage is private insurance that employs tactics to amplify profits, such as pre-authorization, in order to delay and deny health care. Such tactics as upcoding or falsification of medical records to make seniors appear sicker than they are permit plans to line their corporate pockets with increased taxpayer dollars. A New York Times article published in October of 2022 reported that 8 of the 10 largest Medicare Advantage insurers have submitted inflated bills. 4 of the 5 largest players, United Health, Humana, Elevance, and Kaiser, have faced federal lawsuits alleging that efforts to overdiagnose their customers crossed the line into fraud. Exaggerating patient health conditions serves to milk greater profits from the Medicare Trust Fund while draining trust fund reserves from traditional Medicare. The Save Medicare Act will end the scam by preventing private insurers from profiting off the Medicare brand. The Save Medicare Act will rename Medicare Advantage the alternative private health plan, even as it will prohibit private insurers from using Medicare in plan titles or advertisements. The bill imposes significant civil penalties and fines for any insurer that continues to deceptively advertise private plans with Medicare in the title, such as Medicare Advantage. Medicare is one of the most popular and important services the government provides, said Representative Pocan. These non-Medicare plans run by private insurers undermine traditional Medicare, often leaving patients without the benefits they need while overcharging the federal government for corporate profit. To emphasize the need to strengthen and expand real traditional Medicare, the 3 Congress members filmed an infomercial video explaining why Medicare Advantage is not Medicare.
Get the program you've paid for and earned. Remember, only Medicare is Medicare.
Only Medicare is Medicare.
Only Medicare is Medicare.